Social insurance is fairly complicated. It requires a level of knowledge and expertise beyond simply knowing the coverage in a policy. A good agent is able to apply that knowledge to a customer's needs. While this is no different than any other policy suitability requirements, social insurance can be easily misinterpreted, and mistakes can be costly. We first worked with Parts A and B of traditional Medicare. Then we looked at the Centers for Medicare and Medicaid Services, or CMS, and we went on to see how Medicare is funded. There is a significant difference between Parts A and B in this vein. This federal program is not dependent on income or other qualifiers like Medicaid. Medicare has few qualifiers, with age being the primary one. It's important to understand the differences between Medicare Parts A and B. Part A is the hospital portion of Medicare, hospitals, skilled nursing facilities, and the like. So relate Part A with facilities. Part B is the medical portion of traditional Medicare and is voluntary. Relate Part B of Medicare to people. It pays for doctors, services both in and out of the hospital, surgeons, physical therapists, and other people who provide care for the beneficiary. There are 3 different enrollment periods for Medicare, and it's important to know them. They are the initial enrollment period, general enrollment period occurring each year from January 1st through the end of March, and a special enrollment period for individuals who lose group coverage. We also looked at important aspects of Medicare deductibles. Remember, the Part A deductible is per occurrence and must be paid at the start of a new benefit period, and the Part B deductible only needs to be paid once a year. Then we examined the Medicare assignment provision and Medicare's network of providers as compared to medical providers that aren't part of the network. Moving forward, we'll look into other coverages available through Medicare and take a close look at a few other facilities and needs, such as skilled nursing facilities and hospice coverage. We'll also examine the limited coverage offered by Medicare for mental health treatment and study how Medicare handles the need for blood and the three-pint blood deductible that may come into play. We'll continue on with an in-depth look at Medicare Part C and D. Part C plans are referred to as Medicare Advantage plans. They're another option for those on Medicare in addition to Medicare supplement policies, which are addressed in a separate lesson. Medicare supplement policies, known as Medigap contracts, are discussed, and the section will finish with a specific kind of Medigap policy called the Medicare Select policy, which mimics a standard Medicare supplement, except it requires the insured to stay within a network of medical providers, whereas a standard Medigap contract is an any provider policy.